posture is everything.
Correct.
When I walk around Boca Raton and I see the different postures, the people that are standing with great posture, walking properly, they look healthy, they look young, and then the people that are, I mean, it ages you
Yep.
30, 40 years just doing this. So that's what I'm trying to get across to the viewers. My goal is just to feel better, to have better posture. I've been saying this for years, but I really want to do it now.
Okay, I'll help you get there.
I feel I need the strength here.
Correct.
Shoulders back, head in the right position, butt out.
It's so much butt out, but just keep your core engaged.
Okay.
Yeah, and we're going to work on strengthening your gluteals, specifically a little bit at the top of the gluteals, to give you almost like a little bit of shelf. We're going to go ahead and keep you stronger, and more importantly, strengthen your core. As you said, work on your posture. So the whole continuum there is going to be a better outcome for you. That melee of services, stretching, the myofascial release, the strengthening, we can get the outcomes we need. First, I just want to go ahead and look at a little bit of your motion, making sure that you have normal motion in joints before I start applying too much of a stress to them. I have a little bit of impingement on her shoulder, nothing we can't address. Okay, so definitely both hips are tighter than I'd like in certain areas. Again, nothing that can't be addressed. What do you technically normally do for Becky? Exercise-wise, activity-wise, or non-activity-wise?
Okay, I go to the gym 3 days a week.
At the gym, what are we normally doing?
I do the treadmill on 15% grade, and I work.
Are we holding on?
Yes.
Okay.
I can't do it without holding on.
Okay, so holding on, folks, is not a normal, what we would call gator walking position. It would be more of a normal movement if you are not holding on. So in her case, I take that 50% grade down to a tolerable grade in which she can walk with her balance and strength and stamina. So what else might you be doing?
And then I work my way around the gym with all the weight equipment.
Key thing, as we said, movement is medicine. She's moving and grooving, working to get her stronger. So that is a very good thing. The key thing is we would just want to kind of pick apart maybe the movement she's doing based upon the symptoms or areas of, shall we say, dysfunction that she's presenting with. I want her to keep her strong, because once we lose our strength, it is difficult to get it back. Can you lift your buttocks up for me off the table? All right, and now stay there. Can you lift a little higher? Good. I want you to give me a little bit of intra-abdominal pressure. Okay, and I want you to squeeze your buttocks. Driving your feet through the table. Is this tolerable? Mm-hmm. Any problem?
No.
No. Okay. And then come on back down. Very good. And I'm going to ask you to do that again. Okay, so again, as you just mentioned to me before about your back, my hips, where should they be? I need you to really be working the top of your gluteal muscles as they're going to attach into your lumbar spine here, because a lot of people will end up coming in with low back pain because they do not have a functioning gluteal muscle, your butt. Right? So we definitely need the butt working. That's the most powerful muscle in the human body, and honestly, not a lot of people know how to use it. Therefore, a lot of people end up having insufficiencies, dysfunctions, or they're sitting all day. We cannot use it while we're sitting, so we need to get it working for us. So you could take a break as well. Very safe and effective movement, minimal risk for injury. She is able to perform the activity, strengthen her glutes, her hamstrings, her core, all in a very safe and effective manner. Okay, I'm going to stretch Becky's shoulders a little bit for her. It's not painful, it's intense.
Yeah.
But as soon as I stop, it goes away. Becky has good shoulder motion, but she has a tight posterior capsule. So I just want to stretch her posterior capsule a little bit. We need to make sure the two-part system of the scapula and that ball, which we call technically the humeral head, are working symbiotically together. When they are not, we get the click and the pop and the pinch and the pain and blah, blah, blah. The key thing we're going to want to do over time is strengthen her core, because that will drive her scapula. Also, it's going to help with her lumbar spine issue. One of the key things with people who have lumbar spine or low back pain is their hips are not moving well. She has a good core. We're probably going to want to get a little bit stronger. But for individuals that don't have a core and don't have a butt, and have hip problems, they're going to end up having low back pain. I can just keep going if I want to. It's more than enough motion. You see, you have plenty of flexibility. So what we just want to do over time is stretch you a little bit. You're like a new woman.
That actually felt good.
I'm going to be giving her some homework to do. Hopefully she's a good patient and she's going to be consistent with that homework. Look out for the next show, we'll find out. One of the key things we're going to focus on in our next series is going to be that of what we call myofascial release, or using maybe a foam roller, how to release soft tissue to go ahead and get it loosened up. All three segments need to be addressed: stretching, strengthening, mobilization.
Okay, Dominic, well, thank you. I've learned some very valuable things here.
Thank you.
Thank you.
Thank you.
Bye-bye.
Have a great day.